Grand Erie Public Health says there are at least 16 confirmed cases of measles in the Brant, Haldimand-Norfolk area, while Southwestern Public Health says they have 3 cases. Both units are calling the situation an outbreak, and as Eric Vieno reports, local health officials say the only effective way of protecting yourself from the disease are vaccination.
Of those cases, 3 are adults and 13 are children.
In a joint news conference today, Grand Erie Public Health and Southwestern Public Health provided an update on the rise in measles cases.
We're seeing a lot of activity down here, particularly in the Haldimand-Norfolk area.
Grand Erie Public Health's acting medical officer of health, Dr. Malcolm Locke, says the reason Haldimand-Norfolk is seeing more cases is because there are subgroups of people who are resistant to vaccines.
Our cases are, I would say, predominantly in the under-vaccinated population, and most of those are going to be non-vaccinated.
Measles is an airborne disease and one of the most contagious. It can actually stay in the air for multiple hours after the infected person has left.
Just to give you an idea, for a reproduction number for COVID-19 was around like 1.4 to 2.4 to 3. This one is 12 to 18, which means that if one person is infected, it will infect like 12 to 18 persons.
The worst case scenario for measles is one that we have experienced in recent memory in Canada. Children die. There's 2 reasons why measles is dangerous. One, the infection itself, which can have a high fever, have the rash, can be severe enough to require hospitalization. But because it kills so many immune cells, the person who has measles becomes vulnerable to all sorts of different infections afterwards.
Grand Erie Public Health acknowledged that it has to do more to spread the message of immunization.
The people that support non-vaccines or the anti-vaccine groups are sending out far more messages probably than we are in a general way. So I think public health really needs to improve our messaging.
And as for those who are already immunized, the health units say there's no need to use masks or avoid people or places. However, if you do develop symptoms of measles, including a fever, cough, runny nose, and rash all over your body, you're asked to call ahead before visiting a clinic. Eric Vieno, CHCH News, Grand Erie.